There's a lot of misconceptions. Cochlear implants, like healthcare in general or surgery in general, has changed drastically over the 40 years cochlear implants have been on the market. When we think about hearing technologies, those have evolved and changed, but a lot of people have maybe met one or two people with a cochlear implant, and they haven't learned maybe something new about cochlear implants since they met that one person who's a recipient. A large misconception is the hearing loss type you need to have in order to receive a cochlear implant. Our indications have changed on who could be a potential candidate of a cochlear implant, meaning who could potentially benefit from a cochlear implant. And so when we first came out with cochlear implants, you really needed to be profoundly deaf in order to qualify and receive a cochlear implant. Now we're seeing cochlear implants really benefit patients who have a moderate to severe hearing loss. As these indications have changed, more people have had access to them. It is generally a 2-hour procedure. Most patients get to go home that same day that they have their surgery. The surgical approach has changed drastically as well. So most of the time, the incision site's really small, right behind the ear. Patients won't notice it, and for most patients, your surgeon doesn't have to shave any of your hair. And then a surgical misconception is often people think the electrodes of the cochlear implant go through your ear canal. And that is a misconception. Everything is more on an internal standpoint. And another misconception is that it is brain surgery. So it's always been more outside of the skull when it comes to surgery, but that is a big misconception about a cochlear implant.